In this communication station, we provide a scenario around the safeguarding issue. The key bit is to understand that it's a safeguarding and how to delicately introduce this kind of topic and how to navigate these discussions. So let's see how the candidate starts.
You were asked to examine Dawson, 4-month-old boy, who has been brought by her mum Lisa. Lisa was asked to bring her son by her health visitor. Dawson has been losing weight despite being exclusively breastfed. Lisa has three other siblings, all breastfed and born at home, including Dawson. Baby on examination looked marasmic, with baggy, redundant skin in axilla, groin, and buttocks. Plus, okay, Dawson has three other siblings. Then, baby looked marasmic, with baggy, redundant skin in axilla, groin, and buttocks. Plus, for the last 3 weeks, Dawson has been having paroxysmal cough. A cough fit, actually a cough fit, okay, cough fit lasting 1 to 2 minutes with a whoop at the end of it. Mum took Dawson to a GP and GP gave oral amoxicillin for 7 days, but cough isn't improving. Baby's birth weight was 3.2. 2 weeks back was 4 kilograms. Dawson at the moment is 4 months old. Okay, today Dawson is 3.9 kilograms. There are no bruises. Clinically, nothing significant was detected as a reason for this failure to thrive. All four of her children are unvaccinated. Hesitantly, mum agrees to do blood test and chest X-ray. Chest X-ray reveals query aspiration pneumonia, and bloods are suggestive of pertussis. Okay, whooping cough. Speak to mum now, who wants to leave the hospital ASAP. Okay, so Dr. Rais can put 4 minutes preparation time. Everyone should prepare. How would you tackle the situation? Okay, the scenario.
Hi, I'm Dr. Harshada. I'm one of the pediatric registrars. Can I confirm if you're Lisa Dawson's mom?
Yeah, hi, I'm Lisa.
Yeah, hi Lisa. How are you doing?
Yeah, I'm okay. Yeah, I'm just worried about Dawson.
Mm-hmm. So, do you know why we brought Dawson in? Do you have any idea what's happening? Can you tell me
Yeah,
what you know about Dawson?
yeah. So it's basically Margaret, my health visitor, who asked me to bring Dawson in today.
Mm-hmm.
And so I understand that he's not gaining weight, but I am what do you say breastfeeding him, and he takes all his feeds. But unfortunately, he's had this cough for around 3 weeks now,
Oh,
and it's not going away. So I took him to GP, and they gave us antibiotics. But now the
mm-hmm.
cough's almost it's a bit reduced, and it's a little better than before. So I guess he didn't feed well during the infection time, and after the
Mm-hmm.
course of antibiotics, he is slowly regaining his. I think he's slowly feeding better now. So I think he should be fine. I just need to crack on with my breastfeeding, and he'll be fine.
Mm-hmm. Yeah, I completely understand that you're quite worried about Dawson, and it's understandable. We're a little worried about Dawson now. We have
Hmm.
done a few checks. As you can
Yeah.
see, that he's not been gaining weight as much as we would like him to.
Yeah, I
So,
think I think that's basically because he was ill. When
mhm,
someone's ill, babies don't feed well. So now, since he's not so ill, and he took around nine good feeds while in the hospital. So I am pretty okay with him. He doesn't vomit or I think it's just this. He was just a bit under the weather and he wasn't feeding well. So now he's starting to feed well. So I think it should be better now.
yeah,
So
mm, yeah.
yeah,
So, so just to inform you about what we've done for Dawson so far, we did a few checks in terms of his X-ray and bloods. So the X-ray shows that there's something called as aspiration pneumonia, which we are
yeah.
suspect, which means that sometimes while feeding, the milk can go into the lungs,
Hmm.
and that sort of uh, cause a patch in the lung, which needs to
Yeah.
be treated. Also, the bloods are suggestive of a whooping cough. This is
Yeah.
pertussis, needs to be treated.
What do you, I didn't understand. I've heard of this cough, but
Yeah,
uh,
yeah. So I understand Dawson has not been vaccinated, and generally we give vaccines for pertussis in order to avoid these infections. But
all
because
yes, my all of the kids are not vaccinated as well, so they've been all fine.
yeah,
And he was only this last 3 weeks, Apart from that, he's been really well. Dawson's been really well.
yeah. So now what would like to do for Dawson is we'd like to admit him and give him some antibiotics for his treatment. And also we'll monitor how he does in terms of his growth, in terms of his weight gain. So we are a bit concerned about his weight gain as well as the whooping cough part of it. And
No,
I
doctor. Unfortunately, I can't stay. I mean, just give us another round of antibiotics, and he's got better when compared to previously with the first 7 days. Just
Mhm.
give us another round of antibiotics, it should be fine because I really take care of my son. So I know him better than you guys. So I'm his mother. So I guess you give me another round of antibiotics, and I should be fine because. And if anything is there, I can ring Margaret, my health visitor. I live nearby. I just live down the lane near to the hospital.
Yeah, is there any specific reason why you'd want to go home, or how can we help you in that way?
I have three other kids, and my husband works in a factory. So, um, and I have my own business. I am a chiropractor. So I've got things to do. And, I understand he has lost weight, but that's I need to. I'm feeding him really well, and he's taking all the speeds. So I guess it's just I need to once you give me another round of antibiotics, and once the infection goes away, he should be fine.
Mm-hmm. Yeah. So I understand that you have a very busy life, and I do understand you have three kids to take care of, which is really difficult. So do you have any support, anybody else who can take care of the kids while Dawson is in the hospital so that we can manage him here and take care of him in the hospital whilst somebody can take care of the kids? Do you have any
No,
support?
that's exactly why because there's no one for my other three kids as well. So and as you see, the nurse who just had a look at him right
Mm-hmm.
now says the numbers are all good. His sats and his heart rate, everything looks fine. So I don't see the dire necessity as to put him get him admitted. So
Mm-hmm.
he is taking his feeds. He doesn't need oxygen or anything. So I feel like give us another round of antibiotics, and I can bring you in one of the clinics later on. But I really need to go now.
Yeah, I completely understand this is difficult for you, and managing kids at home
So that's
would be, yeah,
6 minutes.
but,
You've got another 3 minutes.
yeah. But Dawson at this point requires hospital admission. We are quite worried about a number of things. One, him not gaining weight. His birth weight was around 3.2, and now he is around 3.9, which is only a 600 gram of weight gain, which is absolutely, um, which is not really what we would like him to grow as much. And he's not vaccinated, which is making him vulnerable to infections. He doesn't seem why he's when we look at him and we examined him, his skin looked quite, his muscle was quite in terms of his uh, weight gain.
And
He looked quite low, so we are quite worried about him, and we'd
yeah,
like to admit him. And
yeah,
I am sure if this is the best we can do for him, and this is the best interest of Dawson, we will
yeah.
give him the antibiotics that we need.
I am his mom at the end of the day. I know him better. So I feel like, I spend most of my time with him. So I feel for my child, at the moment he doesn't need admission. So it'll be a big favor if you can just send me home on another round of antibiotics. I can come on another clinic visit if you can arrange one for me. I really need to go now.
I completely agree. This is very difficult
Mom,
for you, and I understand your problems. But
mom starts crying now.
I'm so sorry, Lisa, that this is a very difficult situation for you. It's very stressful having four kids to manage, and
Yeah.
but we want to do the best for Dawson, and
Mm.
I think the best treatment would be in the hospital and not at home. He would need antibiotics. He would need to be fed well, and we also have to keep an eye on his chest because he has some kind of a pneumonia, which we'd like to know
He,
whether he's being
I,
fed properly.
it's been like, almost 7 hours since I'm in the hospital now. And during these times, he's had his feeds really well.
Okay.
So I'm not worried about his feeding. It's just that he had an infection and his weight dropped. Now he's recovering. So I think he should be fine if I feed him. So I don't think I need to stay, doctor, because I really want to go now.
I can understand it. It's been a really long wait. 7 hours is quite long, I understand. But what we're trying to do here, Lisa, is giving the best treatment for Dawson. Um, this We would ideally like him to stay in the hospital, and we can monitor him well. We can keep an eye on his feeding and on his weight gain. We will also monitor how he is feeding.
Can the health visitor weigh him tomorrow at home?
Yeah.
And
So
I'll
that
let
We
you
have
know.
to make sure that he gets the right amount of feeds.
so that's
Uh,
time up. So, as you can hear, the candidate was clearly hesitant to bring out the topic of safeguarding with the role player, and she later admitted that she had identified that this is a case of neglect, and this mistake is made by a lot of candidates in actual exam. So, let's have a look at the discussion snippets.
I didn't see bruises, but I was thinking, should I go the safeguarding way?
This is neglect.
Neglect, would you then investigate like a proper safeguarding, or you would just, because there are no bruises and
Yeah, so listen. I am kept on reiterating that I want to go, right? At least would have said 5 times, right? So in an actual scenario, the in your station, the actor, and if you read the question, it is written hesitantly, mom agrees to do blood test and chest X-ray. Okay, and it is the health visitor who asks the mother to bring the child. The mother is not even that concerned.
This is one of the common mistakes which candidates make. They just they dwell into the history taking part, and you will be wasting your time. You will be so not fulfilling your task. And you're in this situation. You have to know how to de-escalate. So
Yeah,
if the examiner, if the role player is just jumping about, you try to reason with them first. You build
yes,
rapport, reason with them. They're not doing. Then you start bringing in securities, the
yeah.
so hospital security. Then even if they don't consider, then you
Police.
start bring police.
Yeah, so you don't like blatantly tell to the mom we are suspecting neglect, or we have some. You could say like you have to play with your words and they say we suspect that the child is, see, like what Dr. Rais has written, child is not being cared enough to an extent that.
I gathered as a tip, for these sensitive discussions, always use passive voice in your statements. Like, for example, here we will be obliged to involve the police and the social services. A clear evidence that the child has not received enough care. But I would we will try to find that we'll try to find out why, and I'm sure you would also like to find out. The mother will get silenced after that. The mother will say, yes, I would want to find out, even though if she's.
I knew this is neglect, but then I was trying to be nice to her unnecessarily. I didn't want to get to the police and everything.
Yeah, this is what they want to see you, that you are
So
not so soft or so nice that
yeah,
you
Harshada,
you compromise the child.
you might feel like oh,
I,
I was
no, no,
really good.
I would
I
have
I spoke.
admitted this child, but in this scenario, I thought I had to be nice to her and convince
Yeah,
her. I thought it was about convincing her to stay and not about. Okay, yeah, got it.
The culprit was someone else. So this is the advantage of keeping the tone passive, not avoiding the pinpointing. That will help you a lot uh, in dealing with these sensitive introduction of topics.